A very good morning to all of us. We must have seen on our food products statements such as low sodium content, low fat, especially with products like margarines, no added sugar with our juices and drinks. Or we have also visited our healthcare providers like the doctors, the nutritionists, the dietitians, and they have advised us to look out for products which are low in sodium, high in fiber, low in saturated fat, low in sugar, and related statements. Technically, this is what we call the health and nutrition claim attached to a product. And these statements are aimed at achieving two objectives. One is to help you, the consumer, to choose the product that contains a controlled level of a certain nutrient. And secondly, it can also be used by the manufacturers to increase the sales of their products by informing you that this product is better than the other based on a particular nutrient of concern. What is very critical and important is to ensure that the principle of food labeling, especially that relates to ensuring that the information is not misleading, deceptive, and is not false, must apply to those statements appropriately. The second thing that we should ensure is that the claims as indicated on the label and the advice given by your healthcare provider must speak the same language. The use of health and nutrition claims internationally are governed by three key principles, or what I'll call the guidance, that anybody using a claim must comply to. The first one, any product label that is carrying some claims, either nutrition or health claim, must have a complete nutritional information table, or rather what we call the nutrient. It should have conducted a proper nutrient declaration. What that means is that when we go to the nutritional information table, it should be complete. And completeness means it must declare the energy value, protein, fat, saturated fat, carbohydrate, total sugars, and sodium. These are mandatory. All these nutrients should be seen on the nutritional information. You should not choose one or two and assume you have declared the nutritional information of that product. And the expression is usually by gram of protein per 100 gram of that product. For example, if it is a bread, in 100 gram of a bread, how much protein do I find? How much fat do I find in terms of grams? How much sodium do I find, which you can express either as a milligram or even a gram. Milligram would be preferred, but if you express it in gram, it's still okay. In some cases, as guided by the second principle, any claim that you attach should have its nutrient declared on the nutrition information, or rather what you are saying, claims should only be related to what is declared on the nutritional information. For example, dietary fiber is not a mandatory requirement to be declared. But if you say your product is high fiber content, then we need to see that information on the label. Because if it is not, then there will be no way of establishing whether indeed that product is high on label, or is high on fiber or not. The third condition is that product targeting children up to 3 years of age should not contain any health and nutrition claim. This is a subject for another day, and there are reasons and justification as to why health and nutrition claims are not allowed for product covering this age, and it will be discussed in subsequent videos. These are examples of some of the claims we usually see: low in fat, high in fiber, free of or contains no cholesterol, sodium, and related examples. For purposes of illustration, I will use fat, saturated fat, sugar, sodium, and fiber to demonstrate how we reach at these high levels or low levels or even free levels. This is a table containing the types of claims and the guidance per nutrient. For example, if we talk of a product containing low in fat or low in saturated fat, what we are saying, if I take 100 gram of that product, and isolate fat, I will only find it to be at 3 grams. That will be low in fat per 100 grams. For example, if it is a piece of bread measuring 100 grams and we test for fat, it should not exceed 3 grams. And the rest will also apply for saturated fat, sugars, and sodium. If I claim my bread is low in sodium, it means for every 100 gram that I present, 0.2 gram at maximum will be salt. If I want to claim salt to be free, it means the sodium content is less than 0.005 grams. This applies to fat, saturated fat, sugar, and sodium. In the case of desirable nutrients, for example, the fiber, the vitamins, proteins, we express in terms of relative to contribution to the diet. In this case, you'll find terminologies like high in fiber. It will mean for 100 grams of our bread, 6 grams will be dietary fiber. So this has been established, and this is the same information that we would expect to be seen on the nutrient declaration table or the nutritional information, and based on that we are able to determine whether the claim that has been applied is true or not true. For example, assuming this is a product label that has been labeled properly, it has the full nutritional information, it has even the levels that are declared for each of the product. Assuming it is a label, this means the manufacturer of this product may choose to use any of these claims. It could be low in fat, because you can see the level that we have indicated for fat is about 3 grams, and which is in the levels of the low fat. It has also a high source of fiber. As you can see, we've talked about the high source of fiber being 6 grams, and this product is already responding to that. So it means based on what is declared, a claim can be crafted out of it, and then the consumers will be able to choose based on the information that is provided. So as a summary, for you to believe that a claim has properly been done, you must see the nutritional information table, you must see the levels of those nutrients to which a claim is attached, and the table must be complete as we have discussed. This brings us to the end of today's presentation, and I wish you a good time as you continue learning about health and nutrition claims. Thank you.